Hey, good morning, everybody. Go ahead and fill on in a little bit. Thank you for all for being here. Appreciate this opportunity to talk about something that's why I wore a tie today, according to Dr. Donaldo Hernandez. He basically says I usually don't wear a tie. I said, well, that's because, sometimes some things aren't serious. But what we're talking about today is very, very serious. So I think it definitely deserves this type of turnout by all of you, and it deserves the fact that we're going to stand here to stand up against the president's reconciliation tax law that was just signed into law. First and foremost, let me thank the Santa Cruz Community Health Clinic. Obviously, everything they do for this community, in good times and in bad. Let me thank all of the medical providers that are here, all of the advocates, and of course, the organization. Like I said, and like I mean, we stand here today to stand up to the Trump administration's reconciliations tax law and to stand for our constituents here in the 19th Congressional District, to stand for the doctors who stand behind me, their patients, and our health care in the 19th Congressional District. Look, I think some of you know me pretty well, and you realize that when I do press conferences, I like to talk about how the federal government played its part. I like to talk about how the federal government has done its job. I like to talk about how we've worked hard to affect and enhance people's lives and livelihoods, especially for the people here in the 19th Congressional District. But unfortunately, that's not why we're holding this presser today. Instead, we stand together today to press an alarm about the president's tax law, a self-inflicted wound that will hurt working families throughout this country, that will decrease health coverage in the 19th Congressional District, and yes, could lead to closures of rural hospitals in our community. The reconciliation law will do that in an attempt to pay for an extension of the tax breaks that were given in the 2017 Tax Cuts and Jobs Act legislation. That's $4 trillion in tax breaks for billionaires, for corporations. Oh, and don't forget the purchase of gun silencers as well. And it's all paid for by adding $3.8 trillion to our debt, $3.4 trillion to our deficits over the next 10 years, but also by slashing nearly $1 trillion in Medicaid services, leading up to kicking off 17 million people from their health care coverage. And it makes these cuts in a number of ways. Let me just go through these real quick. One, it limits the provider tax. It cuts $191 billion in federal contributions to state Medicaid programs. That means zero expansions or more cuts in coverage. Two, it restricts state-directed payments of $149 billion. Basically, it ties in Medicaid reimbursements to Medicare reimbursement rate. Trust me, Donaldo Hernandez and I, you'll hear about it from him. We've talked a lot about how Medicare is not keeping up with the repayments that we need in order to provide the proper coverage that's there. Now, it's only going to get worse because they're tying Medicaid into that. It adds co-payments for certain economic levels if you're on Medicaid. It prevents transgender youth care. It prevents care for legal immigrants, except those who have a green card. When it comes to the Affordable Care Act, it shortens open enrollment, and if you don't qualify for the work requirements that I'm going to talk about, then you don't get the ACA. And it cuts off subsidies for the ACA as well. And third, it implements work requirements that will kick out over 12 million people from Medicaid. It does this by saying that if you're an able-bodied working adult, 18 to 64, you need to show proof that you have 80 hours a month of either work, school, or volunteer. In that, there is a doubling of reporting requirements. Many who are in that position of having to report are going to find they're going to have to struggle to navigate that system, to meet these deadlines, and some just won't even apply. What that means is that you're going to have to demonstrate that you either meet these requirements or you're exempt from these work requirements. It's going to be the responsibility of the individual to prove these requirements, and the responsibility, the added financial responsibility of the state to verify these requirements. Look, ladies and gentlemen, as much as the majority party in Congress wants to talk about fraud, waste, and abuse, that's not this bill. Now, I get they want to paint a picture for you. They want to have a vision, at least what I heard over and over on the floor of the House of Representatives, this vision of this 20 to 30-year-old male who's just sitting in his mother's basement playing video games. How many times did we hear that in the speeches from the majority party? What they don't talk about are all of the disabled who are on Medicaid. What they don't talk about are that there's 2/3 of those in nursing homes are on Medicaid. What they don't talk about is 1 in 10 veterans are on Medicaid. Look, there's a reason for work requirements, that's why there's no work requirements at the federal level. Let's make that clear. There are no work requirements for Medicaid at the federal level. Why? Because it prevents people from getting Medicaid. I think we're all for work. We understand work and we understand the dignity that work brings, but there are people who just can't do it, and that's why they're on Medicaid. And trust me, states have tried to implement work requirements. In Arkansas, in 2018 to 2019, they had a program to implement work requirements. What happened? 18,000 people inadvertently got kicked off Medicaid. It led to a federal court stopping the work requirement program within 1 year. In Georgia, they spent $90 million on the program, yet $65 million of the Medicaid program went to administrative costs. And in Michigan, they tried it and 100,000 people lost coverage due to red tape. Now look, in California, especially here in the 19th Congressional District, we know that we are better than that. But we do not want to put up roadblocks, restrictions, or barriers for people having essential health care, especially those that need Medicaid. But instead, we have this reconciliation tax bill that was pushed forward by the president and pushed forward by the majority in Congress to benefit the wealthiest families in our nation. I say that because estimates have it that this bill will basically benefit a family earning over $1 million a year. Means that you get $100,000 in tax breaks a year. But if you're a family earning less than $50,000, you only get $250 per year in tax cuts. That's less than $1 a day. To me, as a federal representative who still cherishes the institution, what this bill does is not just hurt our friends and neighbors in the 19th Congressional District, but this bill was really a formal surrender of any serious legislating by the majority party in Congress. It literally is a barfed up bill that's as serious as its name. It's similar to using ChatGPT when it comes to legislating, in that you don't care about self-improvement, you don't care about kicking people off health care or nutrition programs. You don't care about the debt and deficit and the drag on the economy that it's going to cause. All that you care about is living in the moment. We saw that from this legislation, we saw that from this president, and we saw that from Speaker Johnson as they jammed it through the House to get it to the president's desk just to have a July 4th signing ceremony. So to me, I stand here, unlike past press conferences that you've been at, proud of the work that we do in Congress. I stand here dismayed at what the majority party has done, not just to the credibility of the institution. I stand here dismayed at what the president has done to the future of our country. I stand here dismayed of what this legislation will do to people in the 19th Congressional District when it comes to kicking them off their health care. That is why we are here today, to press the alarm bell that we need to continue to stand together for the most vulnerable, those in our community that need health care the most. That is why we are here, and I appreciate all of you being here to spread that message. Now, the people that I have speaking today are all serious providers of healthcare and understand how important Medicaid is to the 19th Congressional District. So it's an honor for me to first and foremost introduce Dr. Casey Kirkhart from the Santa Cruz Community Health. Dr. Kirkhart is a California native and family medicine doctor who serves as a chief medical officer of Santa Cruz Community Health, our host today. And as a working doctor, he has made time to meet patients to come here. Thank you, Dr. Kirkhart, please.
I do. I'm seeing patients in a couple minutes, so I will be quick. Thank you all for being here, Congressman, for bringing us together. When I look out at this group and this assemblage of people, I think about what it took for us to build this very ground on which you're standing, where we provide medical, mental health, dental services to our patients, as well as affordable housing, a model of home and health for everyone to observe and to see. Because I recognize this group as being full of optimism, of hope, thinking about what's possible, and looking forward to providing as much as we can for the people who need it the most. That's what our community is about. That's how we orient ourselves. We posture ourselves as looking forward, and we respond to the needs of our community, whether that's our patients needing mental health services, substance use treatment, COVID vaccination, affordable housing, much needed dental care, mental health services. We hear the needs of our patients, our communities, and we say yes, we will do that. We will move forward and advance services for everyone in this community. Now, what this bill says to me, the ridiculous monikers around this BBB, BS is backwards. This is a backwards facing piece of legislation. This threatens the programs that we've established for our community to provide these essential services. This threatens the budgets of each of our organizations. This threatens the hundreds of jobs we provide here in the community. This threatens my ability to provide high quality medical care. How can I be the excellent doctor that I know I can be when my patients are getting delayed care, they're getting substandard care because they're not getting access quickly enough, they don't have access to primary care, and that then translates into our emergency rooms that become more consumed with the care that we can provide in primary care. Then they're hospitalized with more severe conditions, and our hospitalists are bombarded with care that we can all solve for here in our community with the essential services that they need, and we know that they need. So this is a real threat. This is a real threat to our organizations. This is a threat to our patients who need Medicaid, and it's a threat to the rest of our community who will be impacted as well. So to me, there's nothing forward-thinking or essential about this bill. It's backwards facing. It takes away decades and decades of essential work that we've done to expand healthcare, expand essential services. And I think why it's so important that we are here right now. This is the only way we're going to defeat this. The only way we're going to change this, turn this around, is by coming together like we are today. So let's keep fighting together, keep coming out for our community, and keep fighting for our patients. And we will take this down, and we will undo this horrible backwards bill.
next speaker has been a real partner, a true advocate, and literally the staunchest champion when it comes to healthcare and the issues of healthcare in the 19th Congressional District. Dr. Donaldo Hernandez practices both internal and hospital medicine here in Santa Cruz and is a fierce advocate, as I said, for patients in California and beyond. He recently served as the president of the California Medical Association and now is the vice chair of the California delegation to the American Medical Association. Dr. Dientes.
Good morning. I first want to thank all of you for coming here today. Patients, community leaders, healthcare workers, all of us. I'm at the other end of the continuum of Dr. Kirkhart Casey just a few minutes ago. In fact, I was at work last night at Dominican Hospital, admitting patients and taking care of them, their services, their course of care throughout the community. And honestly, I can tell you that I would love nothing better than have those patients never don the door of an emergency room and get their care in a place just like this. More cost effective, it's better for the patient, it's more patient centered. And we're gathered here in the heart of our community at this health center because healthcare isn't a distant policy issue. It's personal. It's about our families, it's about our neighborhoods, it's about our communities, it's about our future. So I first want to start with my sincere thanks on behalf of the California Medical Association and the entire physician community to thank Congressman Jimmy Panetta. It's a balancing act, isn't it? He has stood with us time and again to protect Medicare, Medicaid, the Affordable Care Act, access to food benefits, and the health of our most vulnerable patients. He's worked shoulder to shoulder with doctors to protect life-saving vaccines and champion legislation to make sure our seniors can see their doctors. And we are very fortunate to have such a strong and consistent voice in Congress. Thank you, Congressman. Thank you. Now, I know many of you are worried about the passage of this reconciliation act, which was just signed a few days ago. And I want to speak to you today not as a policy expert, but as a doctor and as your neighbor. And I want to be honest with you, and I want to reassure you. The truth is, this law is going to have serious consequences. Millions of people, including over 37,000 people right here in our community, stand to lose their Medicaid or ACA coverage. 37,000. Hospitals, clinics, nursing homes across California are going to be reduced, having to reduce services, in some cases close, or not offer services at all. It's going to become harder for everyone, and I don't care if you're on Medicare or Medicaid or you have commercial insurance. It's going to be a challenge. We're going to have to face that, but we're going to have to face it together. And we're looking to try to make sure that people still have access to the care they need when they need it. I also want to say in all of this that we're not alone in this. We, your physicians, we're not going anywhere. We're going to be right here making sure that we keep doing the thing that we have sworn to do, the thing we love, and that's taking care of patients in our communities. And despite this bill, we will continue showing up. We'll continue to treat, we'll continue to listen, we'll continue to advocate, and we'll stand with our patients. Every single one of you, regardless of your coverage or your background. We took an oath to care for people, and no law will ever take that away. It's going to be challenges. Those challenges are real, but so is our community. To keep our doors open, to help patients navigate this complex new system, and to work with our community partners to hold the safety net together. So I want you to do right now, what I want you to take away from all this, don't panic. Ask questions. If you're unsure whether your Medicaid or ACA coverage is changing, talk to your doctor, your health plan, or a trusted community organization. We're here to help you understand these changes and negotiate those. Stay connected to your care. Even if you lose coverage, don't delay important medical visits. Vaccines, seeing those doctors, including this one, will continue to provide services on a sliding scale or through community-based programs. The doors will stay open. Document your work and your education status. Because of these new impositions of strict new work requirements for Medicaid, while the rules are still being clarified, it's essential to keep those records of work hours, of schooling, of caregiving. This will protect your coverage, and we'll figure out the path forward to make sure you still keep that coverage. That's our mission. Help us advocate. Share your story. Tell your local representatives what access to care means to you. These are just not policies, their lives, affected lives of the people that we see every day. We're already working with our state legislators, local governments, and organizations like this health center to preserve coverage and protect services. We're pushing for smart funding solutions to keep hospitals open and physicians available. We're advocating for transitions to give our systems time to adjust so patients aren't left out in the cold and without the care they need. We're making sure that medical students, future doctors, aren't blocked from entering this profession because of unfair loan caps and unsustainable payment systems. HR wants a setback. No way of sugarcoating that or putting lace curtains on it. But it's not the end of the story. Not here, not in Santa Cruz, not in Monterey, nowhere on the Central Coast. And this is not just this clinic that deserves everyone who needs care. Everyone matters. So we'll keep doing what we always do. Showing up for our patients, fighting for our communities, putting health and humanity above politics. Thank you. Please reach out to all of us, any of us, if you need help, need understanding, and do anything else we can do to keep you healthy. That's what we're here for. Thank you.
Our next speaker is Dr. Devin Francis, the Chief Medical Officer at Salud by Dientes. Dr. Francis is the pediatrician and Chief Medical Officer at Salud. She came to Salud through the National Health Services Corps, where she previously served as Director of Pediatrics. At Salud, Dr. Francis has been a champion for our community, where she helps provide comprehensive services to low-income Santa Cruz families. Dr. Francis, please.
Good afternoon. I'd like to start by thanking Representative Panetta and his team for bringing us all together here today. As a physician, I'm very concerned about this legislation for myself, patients, our community. We've spent more than a decade expanding access to health insurance, and this bill is rolling it right back. One of the biggest concerns about HR 1 is this loss of Medicaid coverage for potentially millions of Americans. Medicaid, also Medi-Cal in California, is a critical safety net for children, pregnant patients, seniors, and those with disabilities. Over 40% of all births in the United States are covered by Medicaid. For the past 45 years, Salud has worked to build trust with our community and expand access to healthcare. As a community health center, our mission is to provide healthcare to the community, regardless of where you come from or your ability to pay. The majority of our patients have Medi-Cal insurance, and as we've expanded Medi-Cal over the past 10 plus years, our rate of uninsured patients, meaning the amount of uncompensated care that we do, has decreased from 30% in 2012 to just 8% in 2024. This means that Medi-Cal is paying for the majority of the services that we provide. And then as a nonprofit, we reinvest any money that we make back into the community. So whether we're talking about adding services like acupuncture or specialty services, bringing on new staff roles like nurses and community health workers, the money from Medi-Cal directly helps the health of our community. We've steadily focused on prevention and early intervention, also known as upstream health. That's how we can prevent chronic illness, how we can care for people before their medical conditions become so costly and complex to treat. And we keep them out of emergency departments for preventable conditions. These cuts will undo all of that progress. Because regardless of whether or not we have health insurance, we all need health care at some point in our lives. And without insurance, without Medi-Cal, some patients may forego care, or they may delay needed care like their checkups, vaccines, or just managing their diabetes or high blood pressure. Without Medi-Cal, community health centers like Salud will still care for our patients. That's our mission and our mandate. We'll still be here, but it will be more uncompensated care. And that means that we still have to find a way to pay for that care. We still have to pay our staff. We still have to keep the lights on. We still have to keep the clinics stocked with supplies. Emergency departments will still see patients if they don't have insurance. But again, that uncompensated care is not free. So when hospitals and clinics are not reimbursed for care, we have to find other ways to cover costs. So That could mean more overcrowding in emergency departments. That could mean reduced staffing, higher premiums for those who have private insurance. We're just reducing service lines altogether. Everyone is going to feel the impact of these cuts, regardless of if you are covered by Medi-Cal or have private commercial insurance. This includes, by the way, children's hospitals. They're highly dependent on Medi-Cal for funding, and yet they exist to serve all children, regardless of insurance type, for serious and rare pediatric medical conditions. So this bill was just passed on Friday. I know I still have a lot of questions about how it's going to play out and what it's going to look like. But one thing is that we know this bill was passed with the goal of cutting costs for tax breaks. This is not a healthcare policy. This was not about how do we improve healthcare for our country. It's about people's dignity, access to healthcare, and equity. And it's going to be negatively impacted with this bill. Every professional medical association that I'm aware of understands these devastating consequences. From organizations that represent frontline providers like doctors and nurses, to the hospital administrators organizations, to the colleges and universities that are training the next generation of doctors. Everyone that understands how the healthcare system works knows that when we're reducing access to healthcare, individuals in the community are worse off, and often we end up spending more money than we intended to save. We're really fortunate that we have leaders like Representative Panetta standing up for our community, but these cuts will be deep and they will hurt the community. I'll end by saying that at Salute, our mission mandates that we continue to serve every patient, regardless of where you're from or your ability to pay. So we will continue to be here. And we will also continue to urge our elected officials to find a way to preserve access.
Dr. Lisa Hernandez, our next speaker. She served as in medicine and public health for more than a quarter century, and her connection to the Santa Cruz community runs very deep. Before being selected in 2023 as a health officer for Santa Cruz County, Dr. Hernandez previously served as the county's medical services director and health officer from 2013 to 2016. She's held a series of public service roles here in California's 19th congressional district, including with counties of Monterey and in Santa Clara. It's my pleasure to introduce to you Dr. Lisa Hernandez.
Good afternoon, and thank you, Representative Panetta and Santa Cruz Community Health, for hosting this important event. I first want to begin by acknowledging the incredible work that everyone here is doing every day. Your commitment to our community, especially those most in need, is deeply valued and now more needed as ever. It is because of your efforts that our community safety net system continues to serve thousands of residents who rely on us for essential care, resources, and support. In Santa Cruz County, nearly 71,000 residents are enrolled in Medi-Cal, and that's actually a drop. And 93% of adults have health insurance. That achievement reflects the efforts that we've done and worked to expand access throughout this community. Within our health services agency health centers alone, we've served nearly 14,000 patients last year through almost 100,000 appointments. These numbers reflect the scale of need and the critical role we are all playing in meeting it. The recent passage of the federal budget reconciliation bill will bring significant changes to the public programs across the country, and our local system is no exception. The changes are concerning, and we know their consequences will fall most heavily on those already facing barriers to care. Furthermore, these federal actions will have a lasting and significant impact on our local safety net system. As health officer, I see how these cuts will affect not just the safety net system, but also the public health infrastructure that supports it. Public health and healthcare delivery are not separate systems. They are the right and left hands of a single interconnected structure. Weakening one part of the system threatens the stability of the other. These impacts will be felt beyond a single department or agency. It will touch hospitals, clinics, public health, and ultimately patients. That is why this moment calls for renewed partnership and shared investment across the entire system. While we do not yet know the full extent of how the cuts will affect us, it is apparent the impact will be real and it will be challenging. In response, we are actively working with other county departments, including our Human Services Department and our County Executive Office, to understand the local impacts. Our teams are reviewing different scenarios and preparing for a range of outcomes. At the same time, we know that we are operating within a shifting landscape. Much of how this federal legislation will translate into state and local impacts is still unfolding. The California legislature is expected to hold a special session this fall after the federal budget is finalized to determine whether changes in the state budget are needed in response to federal cuts. Until then, we are in a waiting period, but we are not standing still. We are using this time to plan, to prepare, and to advocate for our programs, our workforce, and the residents who depend on us. We are here today, united with our community and healthcare partners, to face these challenges together. The pandemic showed us what is possible when we work collectively. Your strength, compassion, and persistence keep this system going and will carry us through whatever lies ahead. Thank you.
Batting cleanup, our last speaker is Dr. Sepe Tagbe. Dr. Tagbe is a Santa Cruz native and has been with Dientes for more than a decade. She currently serves as the Executive Vice President of their operations. She has led the way she's helped expand Medicaid coverage, including dental care, all of which is under threat, as we know from this reconciliation tax bill. Dr. Tagbe, please.
Thank you. Dental, save the best for last. Thank you all for being here today for the work that you do every day, and thank you to Congressman Panetta for bringing us together. So, the so-called big, beautiful bill has passed, but for those of us working on the front lines of healthcare, especially serving low-income communities, there's nothing beautiful about it. And its impact on our ability to serve our patients will be big, yes, but in all the wrong ways. In my almost 11 years with Dientes, I've been incredibly proud of the comprehensive dental care we have been able to provide to our community. We help kids prevent cavities before they even start. We restore smiles for adults and seniors so they can connect socially, get jobs, eat nutritious foods, and regain their confidence. And we do all this knowing that oral health is deeply tied to overall well-being, impacting conditions like diabetes, cardiovascular disease, pregnancy outcomes, and even our mental health and economic well-being. That's why I'm really worried about the impact of these looming Medicaid cuts. If our patients are forced to pay out of pocket, they're simply going to forego care, or they're going to wait until it's so bad that they end up in the hospital emergency rooms, adding more costs and burden to an already impacted system. Dental care will become a luxury, and it shouldn't be. Without access to preventative and restorative and early treatment, people will suffer in silence. Tooth decay, pain, infection, lost teeth will follow. School days missed, job interviews avoided, smiles hidden, people isolated. Dental care is not a luxury, it's essential, and it affects every part of our lives, from our physical and mental health to our economic mobility. We must push back. We must advocate for policies that ensure comprehensive dental care for everyone, because no one should have to choose between feeding their family and having healthy teeth. Thank you.
Great job batting cleanup. Actually, I may not be proud of this bill, but I sure as hell am proud to stand here with these medical providers who stand for all of us here in the 19th Congressional District. Before we get to questions, let me just acknowledge a few people are here. We have representatives from both our Assembly Member's office, Alexis Garcia Arizola from Don Addis's office, Lizette Jones from Gail Pellerin's office. We got Adam Spickler here, who's Mr. Ubiquitous. He's everywhere. This guy tells you how much he cares about this community. So thank you, Adam, for being here, member of the Rio Board. And then, of course, Erica Padilla Chavez, EPC, what I call her, behind me, who's with the Second Harvest Food Bank, and obviously does an amazing job in the face of many challenges that we face, not just in the 19th Congressional District, but in this country, and especially with this bill when it comes to nutrition cuts that they're mandating as well. Let me also thank Laura Marcus, who's here and running Dientes, doing an excellent job, and I apologize if I missed anybody else. And then, of course, express my appreciation for Santa Cruz Community Health, and yes, the members of the press, who we need you to continue to ensure that you're writing and getting out the right stories about this legislation, how much harm it does, but also how much work is going on in this community to push back, to fight back, and stand firm for the people who need it the most here in the 19th Congressional District. I'll open it up to any questions if you have any at this point. And please state your name and where you're from.
Right, DK from the Sentinel newspaper.
Yep.
I know that it sounds like your teams are kind of checking in, seeing what the impacts could be. I'm just curious, some of these impacts you're talking about that we could see, how soon can folks expect to see some of those impacts start to surface?
I think, well, first and foremost, what you got to realize is that this bill was very politically motivated. They're really, besides talking about extending the tax cuts for the TCJA, they're very political in what they did in regards to these types of cuts and benefits, and that they will not go into effect until, at a minimum, after the midterm elections of 2026. Yet the tax breaks for billionaires and the wealthiest families will immediately go into effect and be extended. And so obviously that's why this type of press conference is important. This type of coming together is important, I believe, so that we can prepare and work with our state partners to ensure that the services, as best as they can, as best funded as they can, continue when they come into effect. Let anybody else answer that, go on to that in regards to the initial impact as well. If anybody wants to talk about that, please.
So, I'm Paul Covert, Assistant County Administrative Officer, where we have a whole team set up to look at the impacts from the bill, and we're waiting to see what the state does in terms of its analysis and response. A lot of these impacts are trickle down from the federal government to the state government to the county. So we will, of course, be looking at what happens in the fall if the state holds a special session. And then depending on what happens then, if there are impacts locally, we may have to have a special session ourselves.
You guys are easy. But let's not be easy in talking about this bill. Let's make sure that we continue to ensure that everybody understands the potential impacts that this bill will have on communities like Santa Cruz, on congressional districts like the 19th, but also all across our country, and not just when it comes to cuts in Medicaid, cuts in nutrition programs, and the debt and deficit that this is going to basically blow up when it comes to thinking about our future and our children. The question that I think all of us should be struggling to answer based on this legislation is how much longer can the greatest debtor in the world be the greatest nation in the world? And I think this is something that we as Americans have to answer and have to hold accountable the president and any representatives that basically support this bill and demand that they answer that question when it comes to being a United States representative. So look forward to continuing the fight as we go forward, not just within this legislation, but with this administration. Look forward to basically looking to ensuring that we continue to shore up, as we heard, and work together to ensure that our most vulnerable get the support and services that they need. I'll be around if there's any other questions, and I'm sure our partners will be around as well. Again, thank you to Santa Cruz Community Health. Thanks to all of you for being here, not just what you're doing right now, but what we need to do in the days and the weeks and the months going forward to ensure that everybody gets the proper coverage that they deserve. Thank you, everybody.